And for those of you who may or may not know, this is my third in a series that I've been doing with MedBio Institute, and I really appreciate them giving me the opportunity to speak. I'm Jonathan Kaplan. I'm a board certified plastic surgeon, but I'm also the founder, CEO of DrWell. And what is DrWell? If you think of Rowe and Hims as a direct to consumer website, then the idea is that they've made it very easy for consumers to get access to medications. The consumer signs up and they get the medication, but the problem is their relationship at that point is just with a website. So what we've done as a provider to consumer platform instead of a direct to consumer platform is we've taken all of that technology that makes it easy for consumers to get access to medications, and we put it in the hands of actual medical providers, whether it's brick and mortar or just purely telehealth, or people doing a side hustle. Maybe they're a PA in the ER and then they're doing this on the side. We've taken all the technology to make it easy for consumers to get access to medications, and then make it easy for the providers to submit the prescriptions for them on their behalf to a compounding pharmacy and have the medication shipped to them. So the idea is that we've taken all the benefits of DTC, ease of access, but put it in the hands of a provider, so you have actually ongoing access to the same provider. Whereas with DTC, every time you reach out with an issue, you get a different person, and maybe they'll tell you to go to urgent care, which is never probably not a good use of resources. So that's what DrWell is. And I'm a board certified plastic surgeon in San Francisco. The way I got into weight and wellness in the first place is that we had patients coming in for surgery, body contouring procedures for consults, but their weight, their BMI was too high. They weren't good candidates for surgery. So rather than turning them away, our nurse and nurse practitioners suggested we start a weight program, a weight loss program. And this is before the semaglutide, the tirzepatides. This was back when all we had really to offer was coaching, which the nurse and nurse practitioner really wanted to offer coaching, and phentermine. And so we started that a few years ago. And then these medications became available. And so we started a weight and wellness program in my own practice, and we used DrWell to really scale that. Now we have over 200 providers across the country using the platform to do the same for their own program, so that they can have similar success to what I've had. So let's get back to the topic at hand, that, your real competitors are Rowe and Hims. How do you compete? And first, let's talk about how Rowe and Hims, those direct to consumer websites, how they work. So what they do, for the way they can see so many patients so quickly, is in a lot of states, and I'll get more into detail about the legalities of it all in a second, but in general, the way they see so many patients is they have these simple questionnaires that the consumer fills out online. These are called asynchronous consultations. The idea being that when you see a patient virtually or in person, you're meeting them at the same time. That's a synchronous consultation, but we just call it a consultation. Whereas if the patient fills out a questionnaire and then it's sometime later, minutes, hours later, the provider reviews that questionnaire, that's an asynchronous consultation. And that's legal in most states. That's the only type of consultation you have to have, that you fill out that questionnaire. And then the provider is an independent contractor that is, hired for work by these direct-to-consumer websites. The independent contractor reviews it, and I've heard that through some of these direct-to-consumer websites, the way it works is that the independent contractor gets paid $200 in an hour if you review at least 20 questionnaires, and if you review fewer than 20 questionnaires, you only get $50. That's one way they get paid as an independent contractor. But from the patient's perspective, they don't ever really talk to this person. Their questionnaire is just reviewed. And if they ever have a problem and need to follow up, they're certainly not reconnected to that same independent contractor. They're just connected to whoever is available, a doctor, a nurse practitioner, whoever. But every time they may have an issue, it's a different provider. So you can see how, from a continuity of care perspective, that's just not it. But that's how the direct-to-consumer websites work. That's their business model. They're not looking for that continuity of care. That's not what they offer. They may claim it, but they just, in reality, they do not. But with the asynchronous consultation, in a lot of states, there's no in-person visit necessary, but there may be possibly a virtual follow-up that is necessary in some states, and I'll get into that in a second. And they make it, the direct-to-consumer websites, they make it easy online consumer enrollment with competitive pricing, and they have a large digital ad budget to drive patients to their website. So if you think of all those things, probably none of you have this. You don't have asynchronous consultations capability. You may not have an easy online consumer enrollment portal. It's probably not mobile friendly. It's not easy for the consumer to sign up. Like maybe they call and give you a credit card over the phone, but that gets into issues with of violating the terms and conditions of Visa and MasterCard if the card's not present for high risk services. But I digress. So a lot of obstacles you have to think about when you're getting into this. And you probably don't have millions of dollars to spend on an ad budget to draw people to your website, especially if you're not legit script certified, which I'll get to more in a second. But taken together, this is why they're siphoning off patients from your weight and wellness practice and your practice in general, because you're not doing these things and the consumer wants it to be easier. So, how DrWell or any kind of platform you might find out there can help you is that we can help you with asynchronous consultations, make that easy for you. We call them DrWell Smart Consults, mobile friendly online enrollments for your patients, automating that subscription charge every month so you're not having to manually charge them every month. And we'll talk about some pricing models that can make it easy so that you are more competitive with the direct consumer websites, but also a different tier for your patients that come in to see you in person where you're providing more services to them. And then we'll talk about marketing and how you can do better at marketing um, uh, than what you're doing right now. But you do have to recognize first off who your competitor is. It's not the colleagues next door. It's not the colleague down the street. I know we've traditionally been used to, saying we're better than that person down the street, but that's really not who your competition is anymore. It is the Rose, the Hims, the online direct to consumer websites they're redefining how patients choose care. And we want to keep you in the game, give you a chance to remain in the game to level the playing field. So you have to think about, what do you have that they don't? They don't have real relationships. You have real relationships. You have real accountability to your patients. You've got malpractice insurance. You want to do right by your patients, and you have real outcomes. And what do they have that you don't? They've got modern, frictionless technology, kind of that online ease of access, asynchronous consultations, the mobile-friendly websites to enroll. That's what they have that you don't, and that's how we can help you. So let's start by getting into what I was saying, the DrWell Smart Consult or an asynchronous consultation to expose you to this as being a legitimate form of patients getting access to you. So if you look at the traditional process, that's the flow chart in the dark blue. The patient calls into the office, and this may sound familiar to you. A lot of you, the patient calls in the office. They wait for somebody to answer. The person who answers probably doesn't know enough information to give them. But finally, they get around to scheduling an appointment that's days or weeks later. Maybe they have to come in. They have to take off work to come in person. And then they receive a prescription, and then they have to go stand in line at the pharmacy. If that sounds awful to you, that's awful to patients too. That's why they don't want to do that anymore. And that's why if you're still doing that traditional process, that's why you're losing patients. It's very clear cut. And so with our process, which is taking a page from the DTC playbook, is that we have patients fill out those online questionnaires, and then we can actually respond to that online questionnaire with a message and a link to sign up for a program, a subscription package, whether it's GLP-1s or testosterone or hormone therapy or hair loss treatments, skincare, even prescription grade skincare. But we can respond to that questionnaire, give them a link for them to sign up online in a mobile friendly format. And then once we receive that order, that auto generates a prescription in the back end of our system. And then we're able to submit that prescription to the pharmacy directly electronically, or the provider is able to submit that prescription to the pharmacy. And then the medications are shipped out to the patient. So that's exactly what DTC is offering, but you just don't have all that technology to do it. That's what we offer here. So let's talk about asynchronous consultations in more detail. DrWell Smart Consults, that in 31 states, that a questionnaire is all you need. That's the ones in gold. That's all you need is an asynchronous consultation. They fill out that form. You're certainly welcome to follow. We're not trying to change the way you might want to practice. If you want to see them as a follow-up virtually or in person, that's fine. But we give you the option of the patient filling out a smart consult. It's on a website. It's on our domain. Which allows us to market it or advertise with legit script certification, which I'll talk more about in a second. But it's specifically Smart Consult, specifically for you. They don't see any other providers. They fill that out, and then that goes into the back end where you can review those Smart Consults. And we've got Smart Consults where they can choose the concern they have at the beginning, and then that takes them down different pathways, whether it's weight loss, sexual health, or longevity. And even now, addiction and behavior. We actually have a webinar coming up where we're going to be talking about GLP-1s and addiction. And it doesn't have to be like addiction, only alcohol use disorder and opioid use disorder, but any other kind of repetitive addictive behaviors or cravings that you have, GLP-1s have been shown to help, and we're going to be having a webinar about that. But anyway, these smart consults can be on any of these topics depending on the path the patient takes. They fill that out. It's white labeled. It's got your logo at the top, and they fill that out, and then you review it in the back end. And then what you can do is not only, it's actually also reminds you if the patient is in a state, one of those 19 states where you do have to have a follow-up visit, so that way we keep you compliant. And so so that you're reminded of that. But then you review the patient's demographics. And one of the things I want to point out is that something that you probably can't do is that a patient can fill this out, and in under 2 hours, they can be enrolled in a program. So let's say in this particular real patient example, they filled out a smart consult at 6:37 in the morning. I reviewed it just about an hour or so later. And then I sent them, this is a message I sent back to them through our direct messaging, and I included a package for them to sign up with. So like they're interested in weight loss meds, I respond to them after reviewing their questionnaire, give them a link to sign up. And then this is what they get. After I send them that message, they get a text, or they specifically get a text. They click on the link in the text. It brings them to a mobile-friendly page like this, where they see the package, the program that I'm recommending. They click enroll now. You don't have a program that's as easy and seamless as that. And even though these are desktop images, for demonstration purposes, they click enroll now, and it walks them through the process where they put in their credit card information, all their demographics. We process it through a high-risk payment processor. And and then also when they're checking out, they not only have the package that they're purchasing, but then they're also recommended items like, other weight loss, supplements, or NAD, longevity supplements, or hair loss supplements. So that's what's really cool about it. It's just like Amazon, that when they check out, there's other things that are recommended, and then they can go and sign up for those things also. So you're kind of allowing the patient to upsell themselves. So with that particular patient, that was a real patient, I got this email notification of them enrolling in the program after I responded to their asynchronous consultation, their smart consult. They signed up. And so less than 2 hours after they submitted that smart consult, they're signed up for a program, and I'm generating revenue. And this was on a Saturday morning, so without me having to go into work. So a different patient signed up for weight loss meds, just to show you. And then 1 minute later, because of the recommended items, they signed up for some oral and nasal spray. And because of the recommended items for some oral and nasal spray, they also signed up for the NAD nasal spray. So with these recommended items, instead of you having 10 patients with 10 subscriptions, you could have 10 patients with 30 subscriptions. So you can see how you can scale that very quickly by making it easy for them to make those purchases. Now, moving on, I kind of alluded to it already with the mobile-friendly website, that it's easy for them to just click enroll now. With this DrWell process, you can still conduct in-person visits if you want, but on our DrWell Provider Finder, we'll list how you choose to see patients, whether it's in person or whether it's the online questionnaire, the smart consult, or virtually. And so you can see the patient however you want. And then after you see them, you can then go into the back end, whether it's with a smart consult or not, you go into the back end and you send them a link to sign up for a package, either via text or email. They click on that link, and then that's when they get that mobile-friendly interface where they can click enroll now, and then we process it through our high-risk payment processor. And if you don't know about this, that meds, drugs, whether they're compounded or named brand, are considered high-risk services by the credit card companies. And when it comes to Visa and MasterCard, they will shut you down if you that you violate their terms and conditions, that you process payments with the card not present with these high-risk services. So whether you're talking about Stripe or PayPal, who obviously process payments for Visa and MasterCard, they are not high-risk payment processors. You might be getting away with it right now, but we have lots of providers coming to us that they've gotten shut down, not just for their weight loss meds, but for their entire merchant processing for their whole practice, because they were processing payments on a non-high-risk payment processor. How do you know it's probably not a high-risk payment processor? Because you've got a really low rate, like 2.1%. Most high-risk payment processors are closer to 4 to 9%. By going with us, we have a high-risk payment process that we actually get a 2.9% payment processing fee that we pass along to you, or we withhold from your net revenue. But the point is that even though you think your EMR that's processing your payments is a high-risk payment processor, over 90% of them are not, because the rates are typically higher. But because we're working with a processor and we're processing such high volumes, like millions of dollars a month, they are okay with, okay, well, we'll take the risk on you and give you a better rate. And so you would benefit from that lower rate by going with us with our high risk payment process. So, I mean, these are things that you don't even know about. You don't even know about the obstacles and the pitfalls, which we talked about in a previous MedBio Institute webinar. But it doesn't matter if you know about those obstacles or not, they're out there. So that's the whole mobile friendly aspect, processing it through a high risk payment process just to keep you out of trouble. And then it automates it. So, when they sign up and they're charged automatically every month. You're not having to do it manually. The other big benefit is every time they're charged, it updates their dose. So if you're running a weight and wellness program right now, manually, you've got a spreadsheet like this. You know what this is, you recognize it. It's where you're updating the dose each month, whether it's GLP-1s or even testosterone therapy if you get new labs back, but you're having to manually adjust their dose each month and remind yourself what dose were they on previously, what dose are they going to be on this month. And we do that automatically in the back end where you can see here, they start out at the low dose and then they automatically go up each month, or you can lock them in at a dosage, or you can start them on a different dose. So you do have that flexibility, but at least the automation is there where if you don't lock them in, they'll automatically be increased to another dose each month. And what you're looking at here is an electronic auto-generated prescription. So once they're charged, an auto-generated prescription like this appears in the back end. You don't have to put in any of their demographic information because when they sign up for the package, they put in all their demographic information, their birth date and things like that, and whether they, their home address, the ship to address if you want to ship it to them at their home. So all of that is there and automatically updated. And then the other thing is that the compounding pharmacy, specifically with GLP-1s, because you're getting a commercially unavailable alternative formulation for your GLP-1s now, the compounding pharmacies require you to tell them why you need the patient to get a compounded version versus a commercial version that's available. And so you have to include that reason. And so we have that system in place where you can use the drop down and choose the reason the patient needs the compounded version versus the name brand. And then with that prescription, after you review it, it's auto-generated, as I said, and you can see if the dose is what you want it to be. If it was upped each, it's automatically upped each month, but you have the chance to change it. But you review that, and then you submit that prescription, and it is electronically sent to the compounding pharmacy that's got that vial size, that dosage you want. It's got a license in that state. All of that is automatically done for you. When you click submit, it's routed to you, and you could have multiple providers in your clinic, and they each can sign in and do their own specific orders for their patients. And then the thing that's cool about it is that when it's sent to the pharmacy, at that point, we know what medication you've sent, we know what dose you've sent, so we know what the cost of that particular medication is. So what we do is we withhold that from the patient's payment. Let's say the patient pays $500 for semaglutide. You submit a prescription for semaglutide lowest dose, it's $55. We send that $55 from the patient's payment to the compounding pharmacy, and then we withhold our fees, the 2.9%, things like that. And then we send you the net revenue. So we've already paid the compounding pharmacy bill. And because we're paying for all of our providers' compounding pharmacy bills all together in bulk, that leads to volume discounts that we pass along to you. So even if you knew what pharmacies we were using, you aren't going to be able to get the 12 to 37% discount that we're able to get for our providers. And then you'll see when you go ahead and submit that order, you'll see a breakdown of the cost, the estimated cost. And then again, you get the net revenue minus what we pay to the pharmacy and the credit card processing fees. So all done automatically on your behalf, and you just kind of get that passive revenue. Now, when it comes to competing with the direct-to-consumer websites, they do have lower prices. That doesn't mean you have to have lower prices too for all of your patients. There's a couple different options here. You can do a flat rate or you can do tiered pricing. So a flat rate is the same non-discounted price for all doses of GLP-1s, for example. You could do the same thing for all doses of testosterone if you want. But let's say we're talking about GLP-1s because that's what everybody's talking about. But yeah, you would just say you would charge $500 for all doses of semaglutide or $600 for all doses of tirzepatide. And that's okay if you're charging a little bit more, as long as you're providing something extra for the patient. So for example, in our practice, we include freebies like coaching. If they want coaching, they can have up to once a week virtual coaching. But we also provide them free treatment of side effects. So for example, if they are having nausea, instead of sending them a prescription, go stand in line for Zofran, we just mail them some Zofran. It's not that big a deal. It's not that expensive. And we'll send them magnesium tablets, or we'll send them ginger chews if they're having, sulfur burps. But anyway, because we're doing all those things with the coaching and the free treatment of side effects, we're okay with charging them a flat, higher rate for more value and more services. Then on the flip side, for example, if you have patients who are filling out this asynchronous consultation, the smart consult, well, you're doing less upfront. You're still going to be following that patient better than a direct-to-consumer website could. But if all you're doing is really reviewing that asynchronous consultation, you're like sending them a template response in the direct message with a link to a package, you're not doing a whole lot up front. And for those reasons, you could charge less. And so what you could do, and you could charge the lowest possible amount for the lowest dose of a GLP-1. And then what our system does is that each month they go up to the next higher dose, it automatically ups them to the higher dose and the higher price. It sends them an email 2 weeks before letting them know their price is going to go up so they can opt out if they choose. But the point is, you don't have to have them cancel one thing and sign up for another thing. It's automatically rolls them over, re-enrolls them into the next higher package, the next higher price. And then that's what you can do with as far as tiered pricing. Sure, patients that maybe the direct-to-consumer patients, direct-to-consumer sites would normally get, but you can get them away from the direct-to-consumer because you're offering better service ultimately because you have that continuity of care. So these are two pricing models you need to keep in mind when you're offering these medications. And it just it's most makes the most sense when we're talking about GLP-1s, but you can certainly apply this to other types of medications where the dose increases and the price may increase. Then let's talk about marketing. So if you're trying to market on your own, the problem is that you're going to only be able to say stuff like cryptic things like weight loss injections. Because if you say semaglutide, tirzepatide, or if you're talking about testosterone or minoxidil, even for hair loss, Meta and Google and TikTok will not allow you to run ads with those drug names unless you're legit script certified. And legit script certification costs thousands of dollars, takes several months to get done. Well, DrWell is legit script certified, so you can actually leverage our legit script certification and run ads. So what we do is we will run ads on your behalf if you choose. Nobody has to do this, but if you choose, we can run ads for you. We have an ad agency that helps us with this, and we will run ads that mention the terms like tirzepatide and semaglutide and minoxidil and testosterone, and we won't get in trouble because DrWell's legit script certified. Because DrWell's legit script certified, we have to drive patients back to the DrWell domain. So you can't use our legit script certification to drive people back to your website, but that's okay. Because what we do is we drive them to your drwell.com/your asynchronous consultation or your smart consult. So if you choose to do this, we are driving ads specifically for patients to your smart consult where they can't see any other providers. They're not being driven to the provider finder where they could just, you pay for an ad essentially and they find another provider. We're driving them to your smart consult. First off, they fill out a lead, and I'll show you this in a second, and then they fill out a smart consult if they go to the next step. But the point is, you can use our legit script certification to drive people back to the drwell.com domain specifically for your practice for you to capture a lead and fill out a smart console. So let me give you an example of how we do this. If you choose to do this, we run the ad campaign and we drive them back to a landing page that's got your logo. So you provide us with, some collateral, your logo, your picture, and we drive them to a landing page. And actually the landing page is even nicer than this now. You can put before and after photos on the landing page. And then when they get to that landing page, we immediately ask them about demographics. This is just an email, but we've actually updated to when now we're getting their name and their email address and their phone number. And then we've captured a lead already. And then they have the option of going on to your smart consult and filling that out. And of course, the smart consult's got your logo at the top. Now, again, you can leverage our legit certification, so you don't have to pay for it. And so with those Google ads, we're driving people back to the landing page. That's lead generation number one. And then they have the option of continuing on to complete a smart consult, which is lead generation number two, plus medical intakes. You've never gotten leads that complete with medical intake information. And the way we do this is it's a minimum of $1,000 per month plus $750 a month in the ad management fee to manage the ads. And you can go up as high as you want as far as how much you want to spend, and the ad management fee is the same. And the thing is, you don't have to pay for this out front. You don't have to run your credit card. So what happens is if you generate, $6,000 in revenue over the course of a month from your patient subscriptions that are running through, and you run $1,000 for ads and $750. And by the way, you have to agree to a minimum of $1,000, but if you only end up spending $500, we're not going to charge you $1,000. That's an important point. You do have to commit to at least $1,000, but if there's only $750 worth of ads that run, that's all we're going to charge you anyway. So if you get $6,000 worth of ad revenue, or excuse me, of patient subscription revenue, we'll withhold however much you spent on ads, and we'll withhold the $750 for the ad management fee, and then send you the rest of the net revenue after we've paid the cost of goods that I already talked about when you submit the prescription, and the 2.9% credit card fee. So we withhold all that. So you're not having to come out of pocket for any of it. And it's just better from a cash flow perspective. But that's pretty slick that you can advertise without actually having to pay for it up front. And 1 month stats, which we're running this for a lot of providers who've chosen to do this, to take part in this. And one of our providers had 88 leads from the landing page and an additional 12 smart consult submissions over the course of a month. But look at that. I mean, it's like 18,000 impressions, and the cost per click is really, really low. So it's totally worth doing it, and being able to use that legit script certification to be able to say you've got semaglutide, tirzepatide, things like that. Now, as I mentioned with the ads, we're driving them to your smart consult, and that smart consult is a web page with a URL. It's got your logo. Well, because it's a web page with a URL, you can put that URL anywhere you want. You can put it on your own website. So for example, my website, I have a big ugly button on there that says you can get an expedited consultation. They click on that, it brings them to my smart consult. You can put it in e-blast. So instead of people just like following up to inquire about a service you're promoting in your e-blast, they can actually fill out an entire smart consult from the e-blast. You can put it in your link, that link in your link tree, so they can fill out a smart consult from there. And we also don't forget, we actually have a provider finder where we are running our own ads to push people to our provider finder, where they'll find one of our providers on there. And then of course you can put those links on, those links are part of your Google ads with the legit script certification. So a lot of places you can put those smart consult links. Bonus thing I want to talk about is our medical director collaboration program. So right now, if you're a doctor, or if you're a nurse practitioner or a PA in a state has independent practice, you can run your own practice. But there's lots of nurses out there, or NPs or PAs in states that don't have independent prescriptive authority, or even naturopath providers that want to get in on the weight and wellness. So if you're an NP, PA, nurse, or naturopath provider, and you're looking to start or grow or go out on your own with a telehealth weight and wellness program, and you're willing to manage it all through our platform, as far as, all the weight and wellness, using our compounding pharmacies to sign up patients for subscriptions. If you're willing to do all that, and you don't want to be tied down with brick and mortar, and maybe you're looking for a side hustle, then we can connect you with a DrWell provider to serve as your medical director, one of our DrWell providers to serve as your medical director, and we'll handle all the legal paperwork necessary for that collaborative agreement in your state. Now, this also gives me an opportunity to tell you what the cost of our platform is. So just the DrWell platform by itself is $7,500 per year. If you choose to do the medical director collaboration program, that's a one-time fee of $7,500, where we connect you to a provider and we do all the legal paperwork. But because of and those all fees have to be all paid by ACH. But if you are part of the MedBio Institute, you're on this webinar, then for y'all, the one-time $7,500 fee is reduced to $2,500. So we're actually shaving $5,000 off that. You still have to do the $7,500 for the platform annually, but the DrWell collaboration program is $2,500 for MedBio Institute, rather than that one-time fee of $7,500. So pretty significant benefit. So basically, all in $10,000, you can have access to a medical director, get all your legal paperwork done, and then have a way to actually generate revenue, because there are companies out there that will help you with a medical director, but you pay them for that and that's it. You still have to go get all the legal paperwork, or you find your own medical director, but you still have to pay for the legal paperwork. That's all going to certainly be more than $2,500 than what we're charging. And then after all that, if you do this on your own, you still don't have a way of making money. Maybe you still have to go out and buy like aesthetic devices and lasers and get some rental space. With weight and wellness, this is a unique opportunity that's never existed, where you can do all this telehealth. You don't have to get a brick and mortar. You don't have to buy any devices. The only capital investment is the $7,500 annually for the platform, and then that one-time fee, $2,500, just for MedBio Institute participants, and you can get all of that wrapped up into one. So it's a pretty slick deal. So if you're still wondering whether you should incorporate weight and wellness in your practice, you definitely should. You can see the average network provider that's using our platform for the automation almost $90,000 in annual recurring revenue, over 200 patients, $6,100 in savings because we're getting those reduced prices for cost of goods, and almost 70 hours in time saved because mostly you're not having to track down people whose credit card fails. If their credit card fails, we automatically follow up with them, get them to update their card. And if they don't update their card, then there's no auto-generated prescription and you don't run the risk of accidentally submitting a prescription for them. And you can see our top earning network providers doing pretty well, all because we're able to automate, all because we're able to basically give you the playbook of what DTC offers, but in your practice, so it ends up being better for the patient. Another special treat signing up today, aside from that $2,500 medical director collaboration program, if you choose to do that, is that you can if you sign up, we will and you designate a champion on your office staff who's going to run your program. That way you don't have to be so involved. If you want somebody in your office to really run with this, then we'll give them 3 months worth of GLP-1 medication credits, meaning that they'll essentially get 3 months worth of GLP-1s. And then after those 3 months, if your program has a total of 30 active enrollees, we'll send them another 3 months of GLP-1 medication credits. And you just have to, when you choose to sign up, you just have to choose MedBio Institute as your referral source to get credit for that. And with that, we are done. And now I'm ready for some questions. And I promised it would be shorter. At least I promised Katya it would be shorter, and I kept my promise than the past webinars. But if you have any questions, you want to schedule a demo, QR code is right there for you. But we have a lot of people here. So if you haven't asked a question yet, please ask a question. I'm ready for you. I'll be here until the last question comes through. And with that, thank you so much for your time. And thanks again, Katya.
Yeah, thank you so much. So yeah, if you guys have questions, I'll start running through them. Feel free to either put them into the Q&A chat, or you can put them directly into the webinar chat. The first question, is there a DrWell app, or do they need to just go through the website?
Yeah, for the consumer, no app, which I think is a big benefit. They don't have to download anything. If you're seeing a patient and you want them to sign up, you're in the back end of the platform, and you can choose whether to text them or email them a link. And then when they click on that, then they have a nice mobile-friendly interface. So no need for an app.
Okay, great. What is the average monthly gross for a practice doing your program?
Say it one more time.
What's the average monthly gross profit for a practice doing your program?
Okay, so based on the numbers, we actually have a value proposition sheet that we can send out to people. That the average monthly gross is anywhere from $20,000 to $30,000 gross revenue, and then of course comes out of that is cost of goods and the 2.9% credit card fee, as I mentioned. But again, you can just increase the price of what you're offering to the patients to accommodate for all that. But it's $20,000 to $30,000 annual gross. But based on our value proposition over the course of a month, if you look at the cost of goods over the course of the year, because the lower doses of GLP-1s are less expensive, the higher doses. So to give you a realistic understanding, we have this value proposition sheet you can look at that your return on investment, if you're based on how much you're charging, and like assuming you're getting at least 5 patients a month, which is not a whole lot. Based on that, the return on investment with semaglutide is 77%, and the return on investment on tirzepatide is 66%. So I just wanted to give some specific numbers. But yes, gross revenue is $20,000 to $30,000. I'm not guaranteeing everybody's going to do that. But on average, the people that follow our instructions and are not trying to make this more difficult for the patients. Like, I'll give you an example of advice we can give to make it easier for patients to get access safely. Really quick question, a really quick example. We had some providers that saying, we're not going to give the patients any medications until we get their lab work back. And so I definitely agree that you should be getting lab work on everybody, a baseline lab values. But what I found after a year of doing this is that while I still get the lab work on everybody, the lab work didn't change whether they were a candidate for GLP-1s. Obviously, you need lab work for testosterone, things like that. I get it. But for GLP-1s, the lab work didn't change anything. If they were anemic, well, they need to find out why they're anemic, but that doesn't preclude them from these medications. If their complete metabolic profile showed some wonky liver or kidney numbers, well, these medications have gotten approval indications for chronic kidney disease and fatty liver. If their hemoglobin A1C is abnormally high, well, these medications were originally for type 2 diabetes. And if their TSH, their thyroid function, is high, suggesting they're hypothyroid, well, I know people might be thinking, oh, what about medullary thyroid cancer? Well, nobody's going to be diagnosed with medullary thyroid cancer based on a TSH. That's a family history. They know about that. They've got some other potential syndromic issues like within the MEN type 2 space. So the point is, I definitely get labs on everybody, but what we'll do is we'll let patients go ahead and sign up, and we just tell them that we need your lab work by the time we send your second month's worth of medication. And so those are some examples of things. If people do what we suggest to them, then they will increase the number of engagement by patients. They'll have more signups. So that's one example of how, if you take our advice of what we've learned from our 200 plus providers, you can achieve that $20,000 to $30,000 in gross revenue.
Okay, great. Can you send GLP-1s to California?
Oh, I'm in San Francisco. Yes, we have compounding pharmacies that cover California for sure. We have providers in we have providers with licenses in all 50 states plus DC, and we have compounding pharmacies amongst all of them. Collectively, they can cover all 50 states plus DC.
Okay, and actually the next one's about which compounding pharmacy do you use? And
You can sign up with us and you'll find out.
okay. And then how much does the NP pay to
one thing I want to follow up. Even if you did know the compound, I'm being a little tongue in cheek, but even if you did know the compounding pharmacy, you're not going to be able to get the rates we get. So,
okay, that's good to know. How much do the MPs pay to the medical director?
so that's a great question. When we draw up the legal paperwork, we let you, the participating provider, which is the NP or the nurse or the PA or the naturopath provider, we let you negotiate with the DrWell medical provider to decide on what the fee is. Now, this is a really important point. I didn't have time to go into it, but in most medical director situations, you pay a flat fee to the medical director every month, whether you're making money or not. What we do is that, since you are part of the agreement, is that you're using the DrWell platform to process all of your subscriptions for all your weight and wellness services, that because you're processing all that, what we do is whatever you come up with an agreement with your medical director, what percent you want to send them, and that's their payment. They get a percentage of every subscription you process. So it's not a flat fee. If you're not doing that well, you're not paying that much out to the medical director. But that is how you pay the medical director, is a percentage of each subscription. What that percentage is something y'all two negotiate with our attorneys. And then the thing is that you don't actually have to pay them that fee. Just like I described how when you submit that prescription, we withhold the cost of goods, we pay the compounding pharmacy. If you do the marketing aspect of this, we withhold the cost of ads for Google ads and the ad management fee from your net revenue, from your gross revenue, and pay you the net revenue. Similarly, we would withhold whatever percentage you agree on from every subscription, and we, DrWell, would pay that provider. You don't actually have to come out of pocket with it. It's just you get less net revenue in that process. But the cool thing about it, again, is it's based on your activity. It's not a flat fee.
Okay. And so that is separate from the $7,500 fee. And is the $7,500, there's a question if it's covered for all states or specifics?
Right. So $7,500 is just the flat annual fee you pay for the platform, to use the platform. You have to get that to move on to the medical director program if you choose to do that. That's normally a one-time fee of $7,500 that we're reducing to $2,500. And with that $2,500, we will connect you with medical directors in any state you have a license in. Now, people think that they'll just get a medical director in every state and they'll be able to offer services in all those states. No. The bottleneck is not us. The bottleneck is you having a license in that state. You still have to have a license in that state as a nurse, as an NP, as a PA, as a naturopath provider. And then, as long as the laws of that state allow prescriptive authority, then you can then we would connect you with a medical director in as many states as you want. We don't charge you $2,500 for every state you choose. It's just you still have to show that you have a license in that state.
Okay. And then there's actually a question about what type of licensing do you need to participate?
Yeah, I mean, you just you have to. I mean, you still have to get your license, whether it's a nursing license. And if you're a nurse practitioner, I don't know how many nurse practitioners know this, but if you go to apply in another state, you have to first get a nursing license, pay for that, and then get a nurse practitioner license. You can't do them concurrently; you have to do them subsequently. So those are the types of. You just have to have a license to practice whatever your field is, whatever scope of practice you have to have a license in that state. Wherever your feet are and wherever the patient's feet are, you have to have a license in that state.
And then, so as a physician, would working with DrWell be considered more like a contractor role?
No, no, no. That's absolutely not a contractor role. You are your own person. You're not a contractor like for with a direct to consumer website. You're your own practice. We're just helping you automate your weight and wellness program. So you're basically paying us a licensing fee.
Okay. And then this one, I'm based in Louisiana. Can you explain the dark blue states on the map that don't allow asynchronous only visits?
Right. So back on that map, rather than going back to it, the gold states were the ones where a patient can fill out a questionnaire and that's all you need. You don't need to have a follow-up. There were a few red states where it was very explicitly clear in their legislation that you have to have a follow-up visit with that patient after the asynchronous consultation, after the questionnaire. The dark blue states, which was kind of in between, the way the lawyers look at that is it's not explicitly required that you have a follow-up visit after an asynchronous consultation, but um, there's enough information in the laws on the books that suggest that's probably appropriate. So if you're in one of those blue states or one of those red states, I collectively said those are the 19 states that you definitely should do a follow-up visit to that consultation. Excuse me, a follow-up visit to that asynchronous consultation, that questionnaire. You should have a follow-up virtual or in-person visit before you send them a medication subscription. But
Okay.
just think of Louisiana as being a state where you have to have a follow-up visit.
And then this next one, would you recommend a compact medical license to market to areas outside of your
Yeah,
home?
yeah. We one of our providers in particular, I mean, I'm sure we have multiple providers, but depending on what state you're in, you can do this interstate compact where if you get a license in one state, you can get a license in multiple other states, but your primary residence has to be in a state that is part of the compact. California is not in the compact, and that's my primary residence, so I can't participate in the compact. But the idea is that there's a lot of states out there where they're a compact state. If you get a license in that state, you apply, and as long as you don't have anything on your record, then you'll be able to get licenses in all those states. And you absolutely should do that. You absolutely should do that. The webinar we're doing with our addiction specialist about addiction and GLP-1s, he's addiction specialist, an MD, PhD. He's in a state. I think his main state is Pennsylvania, which is a compact state, and so he's getting multiple licenses really easily. It's amazing. I really wish California would be a part of it.
Great. Um, and how do we sign up for Google Ads? Is that something that they have to do as part of like the bigger
Right,
program, or
right.
can they do
So
that
just
separately?
to be clear, to take advantage of all these other great things that we have, you still have to do the 7,500 annual fee to licensing for the DrWell platform. Then, if you need to, you can do the MD collaboration program for $2,500. And then if you choose, you can do the marketing. You don't actually have to pay any extra for that. Like I said, we just withhold that from your from your gross revenue and send you the net. But yeah, you do have to do the DrWell platform first before you can get access to the marketing program using our legit script certification.
Got it. Okay. All right, let me scan through these.
These are all great questions. Some of them are new questions too. I like that.
What if I want to add another service to the existing platform?
If you'll have to give me an example, but I will
The
tell you.
example the example would be Trimix
Oh,
or
yeah,
any
yeah. No,
product
no.
not
Okay,
available.
thank you for clarifying that. So, first off, I want to say that whatever you offer through the DrWell platform, you can choose how much you charge. We're going to just tell you what the cost of goods are so you don't lose money, but you can choose to charge whatever you want through the DrWell platform. It's still your practice. You're just using our software to automate the whole process, get access to compounding pharmacies at better rates. And because we're getting you access to compounding pharmacies, you can offer any service. That compounding pharmacies offer. So yes, you absolutely can do Trimix. We have providers doing Trimix, all the hormone therapy lines, the progesterone pills, testosterone, the bias creams, the BLT creams, all this pharmaceutical grade skincare like Stella, tretinoin, or hydroquinone if you want a higher percentage of hydroquinone. Yes, the GLP-1s, but also oral weight loss medications, oral testosterone therapy, anything that a compounding pharmacy offers, we can help you run that as a subscription through the platform. Our platform also supports Botox subscriptions and filler subscriptions. So if you have all these other subscriptions or memberships and packages already in your practice, you can run all of that through the DrWell platform, and we'll automate those charges each month for you.
Okay, and then there's a couple questions around do you pay the $7,500 up front? Um, do I sign up from the prescriptions prescribed, or do I need to pay first?
Yeah, so to get access to the platform, you have to pay the $7,500 upfront, and then we onboard you. We do the onboarding with the compounding pharmacies for you. You don't have to deal with that. We get you on board with them, and then we show you some packages that we already have built out for you. You can adjust those packages. We'll help you adjust those packages so you don't adjust them incorrectly, and we adjust those packages for whatever medications you want to offer. And then you see patients however you see patients, or they go through your smart consult. And then whenever you send them a link to sign up and they're charged, that auto generates a prescription, and then you submit that through our platform to the
Is
compounding
there
pharmacy.
a fee per patient, or is there a cap on the number of
No,
patients?
no, no, not at all. No, no.
Okay.
It's the 7,500 is the upfront fee. And then after that, we're just withholding fees from the patient subscription, like the cost of goods, like reasonable fees, like the cost of goods, because we're paying the compounding pharmacy, and the 2.9% credit card fee.
Okay.
The
If
rest of it is yours.
if we're in a dark blue state, do you have to do the follow-up visit before prescribing meds, or can you schedule it at a later time, such as during a lab follow-up?
No, no, no. I think to avoid getting in trouble, you definitely should see the patient virtually or in person before you send them a link to sign up for the medication. The other thing you can do, and we've actually done this before, is that remember, you're not sending them a prescription. You're sending them a link for them to sign up, and then you're submitting the prescription order through our platform to the compounding pharmacy. So we've actually had patients who like actually purchased the medication right after they did the smart consult before we had actually seen them, and they were in a dark blue state. So we knew we had to see them first. So even though they paid for it, I mean, you literally could have the links to buy medication on your website through the DrWell platform, and patients could buy it all day long. You just don't send them a link, you just don't send the medication to them until you've seen them or they filled out a smart consult. So yeah, you definitely could have them sign up, they could pay, uh, and then if they did that and you were in a state where you had to have a follow-up visit with them, a follow-up to the consult. I should clarify when I say follow-up, I'm not saying like a follow-up like after you've been treating them a while, then you have a follow-up. I'm talking about a follow-up to the consultation at the beginning. But the point is that they could sign up, they could fill out a smart consult, they can do all these things. You just won't submit the prescription for them until you had that follow-up visit with them. So you can do it a little out of order as long as you don't send them the medication beforehand.
Okay. So I think that's actually it. Does anyone else have any additional questions? There's a question, MedBio. So I'm one of the founders of MedBio. We're a learning and education platform. So we run a lot of free webinars with various partners like DrWell. We also are going to start offering more deep dive courses in the fall. We have one specifically coming up on building nutrition and fitness plans to offer to your patients within clinics. We have a two-part series coming up with Strive on LDN. We have another deep dive course on hormone therapy, specifically for perimenopause. So we have lots of new stuff coming up. Okay, one more question. How many providers are using the DrWell platform?
Oh, we have over 200 across the country.
Okay, great.
It's actually over 200 practices, which means it's even well over 200 providers.
Okay.
Because some of our practices have like 15 people in them. But yeah, 200 plus practices, even more providers.
And then
again, you can choose your own fees of how much you want to charge, and we can get you access to anything a compounding pharmacy offers. And it's not lab grade stuff. It's legitimate compounding pharmacies, 503A, 503B, that are all legit script certified also.
okay. And then is there a fee for the asynchronous medical review? And then how many scripts do you offer per year?
I think that may be alluding to I think they're concerned that we have a cap on the number of prescriptions you can write. No, there's no cap on that. I mean, I guess everybody has their own opinion of like nickel and diming or sketchy stuff, but we're not doing anything weird. It's like you pay the platform fee and you get access to the platform. You get access to the smart consoles. We don't charge you extra for that. You write as many prescriptions, or you sign up as many patients for subscriptions, submitting prescriptions through our platform as you want. There's no cap on any of that.
Oh, okay. And then there's a clarification. They're wondering how many like prescriptions you do per year.
Oh, me in my practice. Oh, I'll just say that we have 900, as of this one, we have 944 patients in our program, weight and wellness program.
Yeah.
So that's 944 patients, which means that's more subscriptions because some of those patients have more than one, but 944 patients. So 944 plus prescriptions, submissions to compounding pharmacies every month.
Okay. And then is there an additional fee for the asynchronous medical review or that's
No,
included?
no, no, that's included.
Okay. Besides credit card and medication fees for cost of goods, what other fees are typically taken out?
No, there really are not. It's just the cost of goods, the 2.9. And actually in the back end, when you like are processing all these, when we're processing all these subscription payments for you on your behalf, you can log into the back end, you can see all of, each patient and what they got and what their cost of goods are. You can see what fees we've taken out. I'm sorry, shipping. Shipping is another one, but that's charged by the compounding pharmacy. So we withhold that also. But you can see all of that in the back end as far as the cost of goods / shipping, the credit card fees or our fees, and then you see the net revenue. And then when we send you your payout, your net revenue, we send that out every month. You'll see a breakdown of like the gross revenue, how many refunds were processed, because patients ask for refunds. You can process those through the platform. You'll see how many refunds, you'll see the cost of goods, and you'll see your net revenue, or you'll see other deductions, like if you chose to do the marketing, you see all of that. We're very transparent.
Okay. Yeah, and then if you want to set up a demo, you can scan this link here and then you can set up a one-on-one demo.
Yeah, the QR code, just take a picture of the QR code. You can set up a demo and we'll be happy to go over everything with you. And people don't believe me, but once you sign up, you can literally submit a prescription that same day. Then, so like maybe you don't have a patient to do it for, but for your office staff, and you can set up separate packages, like employee only packages that are less expensive, but still cover your cost of goods. And so you literally can test out the system on day one when you sign up, or when we go on the onboarding, which we can set up the day of your sign up or the next day. And you can literally set up a prescription and submit a prescription from a patient or an employee that day, because we've already taken care of your onboarding with the compounding pharmacy. So this is not like a week or 2 week long thing. This is, if it takes a long time, it's on you. It's not us. We have a team of 6 people in customer service that help with all of this process of onboarding and the customer service. But the thing is, I want to emphasize that the customer service is for the providers. We're not customer service for patients. The patients are your patients. You handle the customer service for your patients. Our team is dedicated to customer service for the providers and being your go-between between you and the compounding pharmacy. So if there's a concern or an issue, we can make sure we get medication expedited to you or to the patient. And you also, every time you place an order, after it's processed by the compounding pharmacy, depending on what you choose, a link is emailed or texted to your practice or to the patient with tracking information. So that's the other thing that's really cool, is that all the tracking information is included with all this. That so you or your patient, depending on who's getting the medication, because you can send all the medication to your practice and then distribute it from there. That's actually more efficient. But whoever's getting the medication, your practice or your patient, they get a tracking number.
And can they custom label the medication if they're getting it sent to their practice?
They can't custom label it. If you look on our website, we have all these medications that are like labeled with DrWell, and it looks really pretty, but we have a disclaimer on there saying that this is just for marketing purposes. The medications don't actually look like that. They won't let you custom label the vials, because by law they have to have their label on there with like the serial number, the lot number. So I've had pharmacies will say that, oh, we can custom some things, but when you really get down into it, they really don't want to. They really don't want to go to the effort. And so no, the medications come labeled with the pharmacy's label.
Okay. Great. Well, yeah, thank you guys so much for joining today. Again, if you want to set up a demo to specifically meet with Dr. Kaplan on what DrWell offers, like scan the QR code, and that'll bring you to a sign up page where you can schedule a consultation. We'll also be sending out an email after this with the recording, as well as the link, to make sure everybody has it.
All right. Thank you so much. I really
Yeah.
appreciate everybody's attention. It was great engagement. Thank y'all again.
Thank you guys so much. And yeah, we'll have we have a couple other webinars coming up. I quickly mentioned we have a two-part series, Strive Pharmacy. Is going to be back to do some teaching for us. So they're doing a two-part series on LDN on October 1st and 8th. We're going to have the payment doctor in, so we're going to be doing a deep dive on the high-risk payment processors on October 15th. And then Strive is also going to do a webinar on progesterone on October 29th. So we'll be sending out emails. You can also always go to the MedBio website and take a look at our event calendar, and you can sign up there. We have some courses coming up this fall, and then if anyone will be at the health conference in Vegas, we will be there the 19th through the 22nd.
Which that's going to be in what month? October?
October. Yeah, and kind of mid to end of October. Yeah, the 19th through the 22nd. So if anyone is there, we'd love to meet up, say hello.
All right. Thanks again.
I think that's it. Thank you guys so much. I appreciate everyone's time today.
Bye-bye.
Okay, bye.